I don't think people understand how impactful ADHD can be on daily life. Welcome to ABI's Mental Wellness Hub, where we strive to bring you the most up-to-date and comprehensive information on ADHD. ADHD affects millions of people worldwide, influencing their daily lives, relationships, and overall well-being. Despite its prevalence, there is still a lot of misunderstanding and misinformation surrounding this condition. In this video series, we aim to demystify ADHD and provide you with clear, evidence-based guidelines. Let's work together to foster a more informed and supportive community. Don't forget to like and subscribe to ABI's Mental Wellness Hub for more insightful content. Now, let's get started with our comprehensive guide on ADHD guidelines and best practices. Welcome to our comprehensive guide on ADHD guidelines and best practices. In 2022, the Australian ADHD Professionals Association, AADPA, released new evidence-based guidelines for the diagnosis, support, and treatment of ADHD. These guidelines are designed to support the approximately 1 million Australians living with ADHD. The 215-page guidelines include 132 recommendations covering diagnosis, clinical interviews, rating scales for children and adults, and both medication and non-pharmacological options. These guidelines were developed with input from people with ADHD, researchers, clinicians, family members, and community members. ADHD diagnosis involves a thorough process that includes clinical interviews, longitudinal observation of the patient's life at home, school or work, and the exclusion of other health conditions that can mimic ADHD. Screening can take 2 to 3 hours to complete. For children and adolescents aged 5 to 17, and adults, stimulant medications like methylphenidate, dexamphetamine, or lisdexamphetamine are recommended as first-line treatments. If these are not effective, options like atomoxetine, guanfacine, or clonidine may be considered. Non-pharmacological treatments include addressing sleep, diet, physical activity, and cognitive behavioral interventions. Maintaining connections with schools or universities is crucial for supporting interventions to improve attention span. Encouraging participation in extracurricular activities such as music, sports, or social clubs can also enhance social skills, physical movement, and self-esteem. There are several international best practice guidelines for ADHD, including those from the National Institute for Health and Clinical Excellence, or NICE, in the UK, the Canadian ADHD Resource Alliance, or CADDRA and the European ADHD Guidelines Group, or EAGG. The NICE guidelines emphasize a holistic approach, considering the preferences of patients, families, and carers in managing ADHD. Medication trials should be given an adequate period, typically 6 weeks, and ADHD medication should be reviewed at least once a year. The CADDRA guidelines recommend a stepped care approach, starting with non-pharmacological interventions and progressing to medication if necessary. These guidelines cover the lifespan of ADHD and offer practical clinical advice and assessment tools. The European ADHD Guidelines Group recommends tailored treatment involving a combination of pharmacological and psychological interventions. Their guidelines emphasize evidence-based clinical recommendations and ethical standards. You need to watch this if you struggle with ADHD. Understanding and following these comprehensive guidelines can significantly improve the quality of care for individuals with ADHD. Thank you for watching our guide on ADHD guidelines and best practices. Don't forget to like, share, and subscribe to ABI's Mental Wellness Hub for more insightful content on mental health and well-being. Pause 2s. In this chapter, we delve into global ADHD diagnosis methods and recent findings. ADHD diagnosis varies by region, influenced by cultural, medical, and social factors. In the US, DSM-5 criteria focus on behavioral symptoms and patient history. Europe uses ICD-10, emphasizing a medicalized approach. In Asia, traditional methods are integrated with modern tools. Australia's guidelines align with the US, emphasizing community and school-based assessments. Africa and South America mix traditional and modern practices. Understanding diverse ADHD diagnosis approaches highlights the need for tailored strategies. In this chapter, we will cover the different medication options available for ADHD, their effectiveness, and potential side effects. Pause 1s. ADHD medications can be broadly categorized into stimulants and non-stimulants. Stimulants such as methylphenidate and amphetamines are often the first line of treatment. They work by increasing neurotransmitter levels, improving focus and reducing hyperactivity. Pause 2s. However, stimulants can cause side effects like insomnia, decreased appetite, and increased heart rate. Pause 1s. Non-stimulants, like atomoxetine, offer alternatives for those who don't respond well to stimulants. Medication is just one part of a comprehensive ADHD treatment plan. Behavioral therapies, lifestyle changes, and support from family and educators are also crucial. In this chapter, we will discuss alternative treatment options for ADHD, including behavioral therapy and lifestyle changes. Pause 1s. Behavioral therapy focuses on modifying behaviors and developing coping strategies, like positive reinforcement and time management. Pause 1s. Lifestyle changes, such as regular physical activity, a balanced diet, and adequate sleep, are vital in managing ADHD symptoms. Pause 1s. Mindfulness practices, like meditation and yoga, help manage stress and improve attention. Pause 2s. A combination of treatments tailored to individual needs is often the most effective approach. Pause 2s. Continue watching as we delve deeper into support strategies for those living with ADHD. In this chapter, we will explore support strategies for individuals with ADHD in education and the workplace. Pause 1s. Providing appropriate support can make a significant difference, helping them achieve their full potential. Pause 2s. In education, accommodations might include extended test time, breaks, and assistive technology. Pause 1s. Teachers can implement individualized education plans and provide a supportive environment. Pause 2s. In the workplace, accommodations can include flexible hours and distraction-free spaces. Pause 1s. Open communication ensures necessary accommodations are in place. Pause 2s. Raising awareness and promoting inclusivity benefits everyone. Pause 1s. The goal is to create environments where individuals with ADHD can thrive. Pause 2s. Implementing these strategies helps individuals navigate their journeys effectively. Pause 1s. Stay tuned as we explore best practices for managing ADHD. In this chapter, we compare best practice guidelines for ADHD from various countries. Pause 1s. Understanding these guidelines offers insights into managing ADHD globally. Pause 1s. The US emphasizes early diagnosis with medication and behavioral therapy. Pause 1s. The UK focuses on non-pharmacological interventions before medication. Pause 1s. Canada advocates for individualized plans with medication and psychosocial interventions. Pause 1s. Europe highlights comprehensive evaluations and school-based interventions. Pause 1s. Comparing these guidelines reveals common themes and unique strategies. Pause 1s. Join us to explore how these practices improve lives with ADHD. Pause 1s. Stay tuned for more insights in our next chapter. Pause 1s. In this chapter, we will review the NICE guidelines for diagnosis and treatment. Pause 1s. NICE provides comprehensive guidelines for managing ADHD in the UK. Pause 1s. These guidelines emphasize a thorough diagnostic process with detailed history taking and rating scales. Pause 1s. For children, behavioral interventions are the first line of treatment. Pause 1s. For adults, a combination of medication and psychological support is recommended. Pause 1s. Stay with us as we explore more on ADHD management in upcoming chapters. Pause 1s. In this chapter, we will cover the CADDRA guidelines, focusing on ADHD management. Pause 1s. CADDRA provides guidelines to assist healthcare providers in diagnosing and treating ADHD in Canada. Pause 2s. These guidelines emphasize comprehensive assessment, including clinical interviews and standardized rating scales. Pause 1s. For children, CADDRA advocates for a multimodal treatment approach, including behavioral interventions and medication. Pause 2s. For adults, the guidelines recommend individualized treatment plans with medication and cognitive behavioral therapy. Pause 1s. Continuous monitoring and follow-up are key aspects of the CADDRA guidelines. Pause 2s. Adhering to these guidelines ensures effective and personalized care for ADHD. Pause 1s. In this chapter, we will discuss the EAGG guidelines in detail, including their unique recommendations for ADHD treatment. Pause 1s. The European ADHD Guidelines Group, or EAGG, offers a comprehensive framework aimed at standardizing ADHD diagnosis and treatment across Europe. Pause 2s. These guidelines highlight the importance of a thorough diagnostic process that encompasses clinical interviews, behavioral assessments, and input from multiple sources such as parents, teachers, and healthcare providers. Pause 1s. For children and adolescents, EAGG emphasizes the use of evidence-based behavioral therapies, educational support, and, if necessary, pharmacological treatments. Pause 2s. For adults, the guidelines recommend a combination of medication, psychological therapies, and workplace accommodations to manage symptoms effectively. Pause 1s. One of the distinctive features of the EAGG guidelines is their focus on cultural and regional differences, ensuring that the recommended practices are adaptable to various healthcare systems across Europe. Pause 2s. By following these guidelines, healthcare providers can deliver tailored and effective care for individuals with ADHD, taking into account the diverse needs and contexts of their patients. Pause 1s. Stay with us as we explore more facets of ADHD management in our upcoming chapters. Pause 1s. In this chapter, we will provide an overview of the latest research on ADHD and future directions. Pause 1s. Recent studies have advanced our understanding of ADHD, revealing new insights into its genetic, neurobiological, and environmental underpinnings. Pause 2s. Cutting-edge research has identified specific genetic markers that increase the risk of developing ADHD. Pause 1s. Neuroimaging studies have uncovered distinct patterns of brain activity associated with ADHD. Pause 2s. Innovative treatments like digital therapeutics and neurofeedback are on the horizon. Pause 2s. Ongoing research will be essential for refining diagnostic criteria and developing new treatments. Pause 2s. As we conclude this journey through ADHD advancements and guidelines, let's summarize the key points. Pause 1s. From understanding the AADPA guidelines to exploring medication and treatment options, we've covered crucial information. Pause 1s. We also explored the latest research and future directions in ADHD, highlighting innovative approaches. Pause 1s. Now, it's time for you to take action. Seek further information and support from trusted healthcare professionals. Pause 1s. Together, we can make a difference in the lives of those living with ADHD. Pause 1s. Thank you for joining us. Stay tuned for more updates and resources on ADHD. Pause 1s. Don't forget to like and subscribe to ABI's Mental Wellness Hub for more valuable content on mental health and wellness. Pause 1s.